Hi, I'm Leanne Chadwick, the Director of Critical Care at Covenant Healthcare. The Critical Care Department encompasses 4 critical care units with a total of 50 beds, with the ability to surge to 55 beds in peak capacity. In addition, we have 4 progressive care units with a total of 125 beds. Under the critical care umbrella, we also have the hemodialysis unit, the PICC team, the wound care nurses, and enterostomal nurses.
My name is Rob Wood. I'm the manager of Cooper 3 East, the Progressive Cardiovascular Unit. We are a 27-bed unit. We're mostly post-open heart surgical patients. Our patients typically go to the ICUs after open heart surgery for 24 to 48 hours, and then they transition to our floor.
Our floor is a cardiac step-down unit, which means that we have cardiac cath patients that we take care of. We're also the CHF floor, congestive heart floor, so we do a lot of teaching and education like that. Dr. Eunice, who is also an electrophysiologist, sends a lot of his pacemakers here that we have to extract and then put new pacemakers back in. So he does a lot of that for us. We're an excellent learning floor. That's one thing, usually after you work here, you can go anywhere and work throughout Covenant and Critical Care ECC.
There's a lot of different areas where you can get involved in, like cardiac, then there's peds and OB and OR, and there's always room to grow and move up. Like just a year and a half, I'm a charge nurse now, and that's something that's great, that people can just constantly keep moving up. And we have a girl who just became our educator on our floor, and so there's always different roles to play at Covenant.
An ideal candidate is somebody that comes in and confident but not overconfident, but friendly. I can teach skills, I can't teach customer service. So I want somebody that's warm, friendly, bonds with the patients, because that's what the patients want. They want a warm, friendly face when they're scared and they're alone sometimes and not understanding why their heart's racing or why they're gaining 20 pounds with congestive heart failure.
I am so happy that I chose Covenant. It's a world of difference. There's whole time set aside each month to make sure that us nurses are still happy, and when we're happy, patients are happy. Covenant's a huge organization, so for them to really be focused on every department and making sure they're happy, that is huge.
Hi, my name is Audrey Rupp, and I am the manager of the 6th North floor at the Cooper campus. And on the 6th floor, we have kind of a unique situation. It's kind of like an overflow area where we have patients that are either cardiac tele, med tele, or else med surge, so we get kind of a little variety on that floor. We can also house 5 critical care patients on that floor.
I started on the cardiac progressive care floor. I was there for a few years, moved on to neurotrauma ICU, and then was offered the position as clinical coordinator on neurotrauma progressive care. I wanted to help all the new nurses starting out, make them feel more comfortable on the unit, show them around, show them how many cool people work at Covenant, make them want to stay, because this is our family away from our families.
Thank you for exploring our website and our opportunities. We are always excited to bring aboard extraordinary nurses. Please take a look for our nurse recruiter or myself, Leanne Chadwick, Director of Critical Care.